Study Designs in Pharmacoepidemiology Case Control Study Part 1. Learning Objectives. Understand basic concepts in case control study design. So, case control studies are an alternative observational designed to identify risk factors for a disease or an outcome. So the question is, in this design, how do disease cases differ from non-diseased or controls with respect to prior exposure history? We compare the frequency of exposure among cases and controls. We start with the effect that led to a certain cause. Cannot calculate disease incidence rate because the case control studies doesn't follow the disease-free population over time. Okay? So basically, we start with subjects who have the disease of interest. Subjects who don't have the disease are disease-free. And we go retrospectively in time to compare the differences of exposure. So we assess who's exposed and who's not exposed. So, for example, if you look at this figure, you will see the yellow rectangle includes population with outcome or the cases. The purple rectangle includes the controls. Outcome versus no outcome. We go retrospectively or present to assess the exposure. So we will find some people who are exposed and not exposed, also in the control group exposed and not exposed. This is considered a type of retrospective design. There is no follow-up, there is no moving forward in time. Let's look at this example. Smoking and myocardial infarction. In a desert island, population of 2,000 people, prevalence of smoking is 50%. We identify all myocardial infarction cases that occurred over the last year, which equals 40. We obtained a random sample of 40 controls. The question is, what is the association between smoking and myocardial infarction? You should all know that the only acceptable way to measure the association between exposure and outcome in case control study is through odd ratios. So we measure the odd ratio by dividing the odds of outcome occurrence in the exposure group divided by the odds of outcome occurrence in non-exposed group. So if you look at this table, the odds of myocardial infarction occurrence in the smoking group, which is the exposure, is 30 divided by 20. While the odds of MI occurrence in the non-smoking group is 10 divided by 20. If you do cross multiplication, we will have finally odd ratio of 3. You all remember previously from our previous lectures that odd ratio more than 1 means there is a positive association between exposure and outcome, and those who are exposed are more likely to develop the outcome. So smokers are 3 times more likely to develop myocardial infarction when compared to non-smokers. Examples of cross-sectional studies, we use them in outbreak investigations. For example, let's say what's causing young women to die from toxic shock. So we take the cases, young women who die from toxic shock, compare them to women who died from non-toxic shock reason, and we compare retrospective the occurrence. This occurs also in cases of infection outbreak. We have this hospital, we have outbreak of MRSA. Suddenly we have more than usual cases of MRSA. We conduct a case control study. We compare subjects who have MRSA to subjects who don't have MRSA, retrospective to assess what occurred. Also, many of birth defect studies are conducted by case control study. You all know that the FDA regulations prevents conducting clinical trials phase 1, phase 2, phase 3 on children and pregnant women. So many of the contraindications for medications occur through recommendations by case control studies. Also, we can use case control studies if we want to discover a new unrecognized disease. For example, in the 1940s, is smoking the reason for the increase in lung cancer in general? They conducted a case control studies. They conducted 4 case control studies that established the strong association between smoking and lung cancer. Essential features of case control study design. Directionality, we start with the outcome and we refer back to the exposure. This is very important. For each design, you need to know where you start and when you finish. If you remember previously, we said cross-sectional study, we do the exposure and the outcome at the same time. However, in case control studies, we start with the outcome, we identify the controls, and then we go retrospectively in time to determine the exposure. Timing, retrospective for exposure, but case assortment can be either retrospective or prospective. It's okay, I can choose my cases prospectively or retrospectively, but all their exposure will be identified in the past. Rare or new disease, design of choice. It's the best design to assess rare disease if a quick answer is required. Usually, cohort study that require follow-up is not efficient in this case. Challenging, the most difficult type of study design and to execute, and we will see later why. Design population, we can choose population-based versus hospital-based sample. So a quick summary, as you can see, we have a group of interest, we have the outcome group, cancer patients, we compare them to non-cancer patients, we go retrospective in time to take the history, and then we identify subjects who have exposed, not exposed, compare them to exposed, not exposed, and we draw conclusions.